Anatomical terminology. Anatomists and healthcare providers use terminology that can be bewildering to the uninitiated. However, the purpose of this language is not to confuse, but rather to increase precision and reduce medical errors. For example, is a scar above the wrist located on the forearm 2 or 3 inches away from the hand? Or is it at the base of the hand? Is it on the palm side or the back side of the hand? By using precise anatomical terminology, we eliminate ambiguity. Anatomical terms are derived from ancient Greek and Latin words. Because these languages are no longer used in everyday conversation, the meaning of their words do not change. Anatomical terms are made up of roots, prefixes, and suffixes. The root of a term often refers to an organ, tissue, or condition, whereas the prefix or suffix often describes the root word. For example, in the disorder hypertension, the prefix hyper means high or over, and the root word tension refers to pressure. So, the word hypertension refers to abnormally high blood pressure. Anatomical position. To further increase precision, anatomists standardize the way in which they will view the body. Just as maps are normally oriented with north at the top, the standard body map, or anatomical position, is that of the body standing upright with the feet at shoulder width and parallel, toes pointing forward. The upper limbs are held out to each side slightly, and the palms of the hands face forward. Using this standard position reduces confusion. It does not matter how the body being described is oriented. The terms are used as if they were in anatomical position. For example, a scar that is in the anterior carpal region would be present on the palm side of the wrist. The term anterior would be used even if the hand were palm down on the table. A body that is lying down is described to be either prone or supine. Prone describes a face-down orientation, and supine describes a face-up orientation. These terms are sometimes used to describe the position of the body during specific physical examinations or surgical procedures. Regional terms. The human body's numerous regions have specific terms to help increase precision. Notice that the term brachium, or arm, is reserved for the upper arm, and the antebrachium, or forearm, is used for the term meaning lower arm. Similarly, the femur or thigh refers to the upper portion of the leg, whereas leg, or crus, is reserved for the lower portion of the leg existing between the knee and the ankle. Directional terms. Certain directional terms appear throughout this and any other anatomy tutorial. These terms are essential for describing the relative positions of different body structures. For instance, an anatomist might describe one band of tissue as inferior to another, or a physician might describe a tumor as being superficial to a deeper body structure. Some common terms that you should commit to memory in order to avoid confusion when you are studying or describing locations of particular body parts are as follows. Anterior or ventral describes the front or direction towards the front of the body. For example, the toes are anterior to the foot. Posterior or dorsal describes the back or the direction toward the back of the body. For example, the heel is posterior to the toes. Superior or cranial describes a position above or higher than another part of the body. For example, the eyebrows are superior to the nose. Inferior or caudal describes a position below or lower than another part of the body, or near or toward the tail in humans, or the coccyx, which is the lowest part of the spinal column. For example, the pelvis is inferior to the abdomen. Lateral describes the side or direction towards the side of the body. For example, the thumb or pollex is lateral to the digits. Medial describes the middle or direction toward the middle or center line of the body. For example, the hallux or big toe is the most medial of the toes. Proximal describes a position in a limb that is nearer to the point of attachment or the trunk of the body. For example, the brachium would be proximal to the antebrachium. Distal describes a position in a limb that is further from the point of attachment or trunk of the body. For example, the crus is distal to the femur. Superficial describes a position closer to the surface of the body. For example, the skin would be superficial to the bones. Deep describes a position that is further from the surface of the body. For example, the brain would be deep to the skull. Body planes. A section is a two-dimensional surface of a three-dimensional structure that has been cut. Modern medical imaging devices enable clinicians to obtain virtual sections of living bodies. We call these scans. Body sections and scans can be correctly interpreted only if the viewer understands the plane along which the section was made. A plane is an imaginary two-dimensional surface that passes through the body. There are three planes commonly referred to in anatomy and medicine: the sagittal plane, the frontal plane or coronal plane, and the transverse or horizontal plane. The sagittal plane is the plane that divides the body or an organ vertically into right and left sides. If this vertical plane runs directly down the middle of the body, it is called the mid-sagittal or median plane. If it divides the body into an unequal right and left side, it is called a parasagittal plane, or less commonly, a longitudinal section. The frontal plane is the plane that divides the body or an organ into an anterior or front portion and a posterior or rear portion. The frontal plane is often referred to as a coronal plane. The transverse plane is the plane that divides the body or an organ horizontally into upper and lower portions. Transverse planes produce images often referred to as cross-sections. Body cavities and serous membranes. The body maintains its internal organization by means of membranes, sheaths, or other structures that separate compartments. The dorsal or posterior cavity and the ventral or anterior cavity are the largest body compartments. These cavities contain and protect delicate internal organs, and the ventral cavity allows for significant changes in the size and shape of the organs as they perform their functions. The lungs, heart, stomach, and intestines can expand and contract without distorting other tissues or disrupting the activities of nearby organs. Subdivisions of the posterior or dorsal and anterior or ventral cavities are each subdivided into smaller cavities. In the posterior cavity, the cranial cavity houses the brain, and the spinal cavity or vertebral cavity encloses the spinal cord. Just as the brain and spinal cord make up a continuous, uninterrupted structure, the cranial and spinal cavities that house them are also continuous. The brain and spinal cord are protected by the bones of the skull and the vertebral column, and by cerebrospinal fluid. Cerebrospinal fluid is a colorless fluid produced by the brain, which cushions the brain and spinal cord within the posterior cavity. The anterior cavity has two main subdivisions, the thoracic cavity and the abdominopelvic cavity. The thoracic cavity is the more superior subdivision of the anterior cavity, and it is enclosed by the rib cage. The thoracic cavity contains the lungs and the heart, which are located in the mediastinum. The diaphragm forms the floor of the thoracic cavity and separates it from the more inferior abdominopelvic cavity. The abdominopelvic cavity is the largest cavity in the body. Although no membrane physically divides the abdominopelvic cavity, it can be useful to distinguish between the abdominal cavity, which houses the digestive organs, and the pelvic cavity, which houses the organs of reproduction. To promote clear communication, healthcare providers typically divide up the abdominal cavity into either 9 regions or 4 quadrants. The more detailed regional approach subdivides the cavity with one horizontal line immediately inferior to the ribs and one immediately superior to the pelvis. Also, 2 vertical lines are drawn as if dropped from the midpoint of each clavicle or collarbone. There are 9 resulting regions. The simpler quadrants approach, which is more commonly used in medicine, subdivides the cavity with one horizontal and one vertical line that intersects at the patient's umbilicus or belly button. A serous membrane, also known as the serosa, is one of the thin membranes that covers the walls and organs in the thoracic and abdominopelvic cavities. The parietal layers of membranes line the walls of the body cavity. The visceral layer of the membrane covers the organs. This is called the viscera. Between the parietal and the visceral layers is a very thin, fluid-filled serosal space or cavity. There are 3 serous cavities, each having their own associated membranes. The pleura is the serous membrane that encloses the pleural cavity. The pleural cavity surrounds the lungs. The pericardium is the serous membrane that encloses the pericardial cavity, and the pericardial cavity surrounds the heart. The peritoneum is the serous membrane that encloses the peritoneal cavity. The peritoneal cavity surrounds several organs in the abdominopelvic cavity. The serous membranes form fluid-filled sacs or cavities that are meant to cushion and reduce friction on the internal organs. Both parietal and visceral serosa secrete thin, slippery serous fluid located within the serous cavities. The pleural cavity reduces friction between the lungs and the body wall. Likewise, the pericardial cavity reduces friction between the heart and the wall of the pericardium. The peritoneal cavity reduces friction between the abdominal and pelvic organs and the body wall. Therefore, serous membranes provide additional protection to the viscera that they enclose by reducing friction that could lead to inflammation of the organs. Thank you for watching.